Hello, and welcome to Reed Scholars Live. I'm your host, Dr. Mary Fleming, current president of Reed Scholars. Today, we are fortunate enough to be joined by Ms. Alyson Humphrey. Ms. Alyson Humphrey currently serves as the Public Health Accreditation Board Coordinator for the Louisville Metro Government. She received her master's degree in nutrition and food services from the University of Kentucky and is CEO and founder of A New Plate Nutrition Consulting. In her role with the Louisville Metro Government, she has been intimately involved in the city's response to COVID-19. And as a nutritionist, she is acutely aware of how food insecurity can affect health in a global pandemic. Hope I got everything right there, Alyson. Thank you for joining.
Yeah, that was a lot. I didn't know you were going to create such a nice introduction, so thank you.
You're welcome. Well, how are you? How are things going for you?
I'm doing well, given the circumstances. So I take every day, day by day, do my best to stay grounded and take care of myself and, do the best I can. So good.
And definitely, that's even more important than usual in these past few months. And so I know when we initially started talking, we were, as the COVID pandemic was happening, we were talking a lot about health equity and talking about kids not being in school and, just food prices are going up. A lot of things around food was really important. And so I thought with your nutrition background, we could start there. But since then, being in Louisville and, we were both in Louisville for a period of time, a lot of other things have happened around that I think are important to the health equity conversation that are in light of COVID-19. So we can talk about that a little bit later. But let's just, start there and even just kind of what you were seeing and how you were interacting with the public at the beginning of the pandemic.
Okay. So first, I do want to say that if we have any conversations, my opinion are my own. So not of where I work. So as we're continuing this conversation,
Definitely.
These are my own opinions. So you were asking about my insight. So I'm happy to give my insight. But I don't want to speak on behalf of anybody or any other entity. So, but overall, I've seen, I hate to go straight to sound kind of mushy, but I've really seen how the city can work together towards a common goal. Sure. And while, it's been tough, just dealing with everything, people losing family members, not being able to go outside, it's tough. But the provisions that people are making together all around the city it's really like it's a good first step that can give us an idea of the ideal conditions that we can all live in. Like we can all work together more. So, overall, it's been a lot of moving parts. It's been tough, but good. I'm proud of my city. I feel like that, Louisville is a compassionate city, and like I see that in just the dealings with, organizations and folks.
Yeah, and I mean, and overall, looking at the data, it looks like Kentucky overall has done well as far as their numbers and number of cases and exposure and deaths and that type of thing. Do you think there was any one thing that either the city or the state did better than other parts of the country?
I don't know. So I don't want to speak on, I don't want to outshine any other city, because I would say across the board that cities have done an amazing job at responding to it. But one thing that this is just me as a citizen as well, it's the communication piece behind it. I felt like our city has done a great job of spreading information around, whether it's Twitter, Facebook Live, Instagram Lives, and, even just reading the press releases and everything. So our city really communicates with each other well. So I would say that, and I'm biased because I live here and I don't live anywhere else, but our communication has been really good. So, yeah.
And I mean, to go back to your first point, to tie into that, I think one of the things we've learned a lot from the response to the pandemic is how innovative and creative we've been. That's something I've been.
Yes. Yeah.
It's like, well, a lot of time if the same conversation happened a year ago, it's like, oh, I don't know if we can do it. Well, let's get a team together. Let's discuss it. Let's have a task force. But when we
Yep.
had to do it, we had to do it. And it was
Yes.
amazing how teams came together very quickly to solve, very critical problems. And to the second point, and I think that's where the communication piece came in, and really understanding how to communicate with the communities that needed to be communicated with. And so that might be social media. I mean, social media exploded and was a great vehicle, but also just being more aware on the news, right? So having somebody come out and give updates every day so people know what's going on. And I
Right.
think that was more important for like my parents' generation, right? And so,
Mm-hmm.
and they felt well informed and like, people cared. And sometimes that's what we need, just to know people are caring and trying to do something to
Yes.
help us, right?
Yes.
And so then, kind of as this was unfolding, and so, when I was at home, and the protesting started, and I think that was, in a response to COVID-19 unearthing all of these inequities that have been
Mm-hmm.
going on, like, not anything new. But I think, the combination of people being at home, people being just the toddler, we've just had enough.
Yeah.
Then the
Yeah.
protest happened. But in any capacity, you want to speak to your experience just being in Louisville and feeling that climate there?
Sure. I'm thinking that's a good question. Like every time you ask it, I'm like, how should I word all these things? Because I feel a lot of emotions.
Yes.
I'm an empath, so I'm like I feel everything. So, I would say that it shifted from anger and frustration that could be felt across for everybody. I know that we have all been affected, and me working in the capacity, in the position that I do is a whole other perspective. But I would say that it has gone from frustration, anger to action. That I am so thankful, and yeah, I'm really thankful that it's moved from just this is how we feel, we want to shout about it, to let's do strategic action, let's have community meetings, let's talk innovation, let's talk about what does it look like for a just system, what does it look like for people to have better opportunities for food, what does that look like? And like I've been in so many conversations with people really like just coming up with great ideas. So, I mean, so that's how overall it's gone from this is a feeling to action. And then now being in more spaces where healing is happening. Like I went to an event last night where it was all young Black creatives, and it was called a night of healing, believe it or not. So it was just good to be in places with other folks healing together. So I feel like I've experienced the full spectrum of what needs to happen when a big shift is coming, or for a shift to happen. It's not, change doesn't just happen when folks are angry. It happens when people are changing the way that they think and how they interact with each other. So for me, I feel like I've experienced and seen that happening. So, which I had not seen before. As you know, Louisville is historically segregated, and it has its own things going on, but just across the board in a lot of different communities, I've seen that. So that was the long answer.
No,
I answer you. I get to talk at sometimes. So
no, it's good. I mean, I think I feel the same way. So I remember, when I first got home, and watching on the news and I've said this before, like watching the National Guard be in my city, right? And I was like, it was overwhelming. And you're fearful, you were angry, and just disheartened, all the things,
All the things.
all of them. And then, right before I left, going to the birthday celebration for Breonna Taylor, which was a totally different emotion. It was that community. It was that we can work together. We can get through this. We're going to support one another. And it was
Yep.
celebratory, which was an odd, like you wouldn't think that was going to be a celebratory moment, but it made you hopeful. It's like, okay, this, all these things have happened and they're horrible, but this gives us such an opportunity and so much of a potential to come together and work together and hopefully build something better on the other side. And so I think that speaks to both of your points. But I really want to focus on that last thing that you said about healing, because I don't think we talk about that a lot. Because this is it's an emotional, because of the breadth of emotions that we're going through as a country. We have to unpack that at some point, and I don't know if we're doing that well.
Yeah, that, not to cut you off or anything, but that healing piece, I think is not to be too ethereal, but I feel like that is the key to us moving, I don't know, towards a higher timeline, to a higher level of consciousness, is that healing. Because with healing comes a greater understanding of yourself, because you have to recognize your emotions. You have to think through, sit through feelings, understand yourself more to go through healing. So, yeah, I forgot. I probably lost my train of thought, but yeah, it's an important piece collectively that we have to all go through, and to understand that we are living in some unprecedented times, and it's hard. Like, I don't know if you're like me, sometimes I'm just sitting and I'm so tense. Like, I'm like this, and I really have to let me just breathe and relax. So yeah, that healing piece is tough, but we all have to realize that, it starts with small steps, and it's gonna take a lot. It's gonna be a process. Like, I don't know about you, like maybe it's a long time, like healing and identifying your feelings and things.
Definitely. I mean, it took us a long time to get here, and so I think we do have to remember to give ourselves some grace, to let us feel the feelings, but also not to let them hold us back, and help work towards our bigger goals. But kind of switching, let's be a little bit more upbeat optimist.
I'm cool with that too. I like a party.
Well, because I wanted to talk about, or switch to, what are your hopes? Like, in a perfect world, we've gone through all of this. What is your hope for our community? What is your hope for the city? How do you think we can work together? And in that, all of these things happen to us, but we have some empowerment in this to change the situation. So what are your thoughts along those lines?
Wow, that's a big question, but my hope is that this, like, what is going on fuels each one of us. It changes something in our hearts to want better for everyone. So I think that adopting things like compassion, empathy, and leading with love, that is what can shift how we interact with each other and how we live with each other. So we know what happens when there's not communication, there's not love, and there's not systems where people are enabled to be happy and healthy. We see what it causes. So what is now, we're kind of being asked, the universe is prompting us to ask, like, what do you really want, and what do you really need? And the things that you want are possible. So I think that, man, this is tough. I would want everybody to first take time to heal and get more in tune with self, because now it's not just a physical thing going on, but it's a psychological. It's a lot of psychological warfare in your mind. So I would hope that everybody would prioritize their mental health more, and as well as their physical health, and the food that they eat, I know like right now a lot of people are going back to cooking in the kitchen and growing their own food and keeping more of a localized food system. And I would encourage people to continue to do that, because the food that you eat and what you put in your body is a part of healing your physical body, but it also heals your psychological mind as well. I don't know if you're like me, but if you eat clean, you feel better, you function more. So I'm blabbering a lot. What did I say? Health, food, and joy. Prioritizing joy. Yes, I think I want to. Yeah, that's a big one. Prioritizing joy, meaning prioritizing time with your friends and your family and those connections, because we can't, like, in order for us to get through things together, we have to like come together. And so that means enjoying time together, and also getting back to figuring out like what you really want and what drives you and what passions that you have, and spending time exploring that. So if you like, this quarantine and everything has like gotten the best of me, but I like art. I like doing art. I love floral sculptures and things like that. And so really I need to invest more in doing that, to explore more moments of joy for me. Like that really makes me happy, and I need to give myself that joy more. So that is the long answer.
No,
Again,
it's perfect.
cut me off at any time.
No. That was perfect. And I think, and that's kind of how I wanted to end. Like I told you, I was like, let's end on an optimistic note. Because the other thing I'm trying to make sure that I reinforce during these podcasts is when we talk about health equity, it's not just about the medicine. It's not just about the healthcare you receive at the hospital or the clinic or whatever. It's about how your everyday life affects your health. And that's the things that you're talking about. That's socialization. That's making sure you're eating well and have access to food. That's making sure that you're taking care of your mental health. It's making sure that you're, being physically active. It's making sure you have access to, employment and being able to take care of your kids. It's all of those things. And so
health equity is opportunity. Do you have the opportunity to live your healthiest life and be your best being? Yeah.
And how we can best get there. And so, and then some of it is talking about it, making people aware. And then some of it is doing the work, so when and because something that's important to you, when you go to your work, and just like when I go to my work, you're looking through that lens and trying to help people be the best people, like you said, have the opportunity to live their healthiest life. So yeah, that was perfect. Well, thank you so much for joining us today. It was a great conversation, and I'm glad you're doing well and got to check in to see how things
Yes, it was great to talk to you too. I appreciate you asking me to come on. I really appreciate it.
No problem at all. Well, thank you again, and I'll talk to you soon.
Okay, bye.
Thank you for listening to Reed Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.